in this session, we'll be going on for the other remaining metabolic conditions. As we told, learning is a continuous process. So we have to learn daily. So day by day, we have to learn and we have to accumulate more knowledge and we have to apply these things. As a practicing veterinarian, whatever we learn, we have to apply in the field conditions. Then only it will be useful for the farming community. So as we discussed in the metabolic conditions, in the part 1, we have completed all these things, milk fever and hypophosphatemia and hypokalemia and all, post-parturient hemoglobinuria. And ruminal acidosis also comes under this thing. Ruminal acidosis and displacement of abomasum is also.
Sir, just Shivaraman sir, sorry to Dr. Mr. Rohit. Mr. Rohit. Rohit.
Yes, sir.
Rohit, part 1 is visible on the screen. So can you just check it out?
Okay, sir.
Please, huh?
No, sir. यही है, sir. Part 2 ही.
Okay.
Okay, sir.
As a veterinarian, we have to be confirmed in the diagnosis of 2 conditions. One thing is acidosis, another thing is the ketosis. We have to be sure. Otherwise, suppose if you are diagnosing a case of acidosis as ketosis and you are treating the acidosis case with the dextrose solution, the condition will be getting aggravated. And also, if you are diagnosing a case of ketosis wrongly as acidosis, ruminal acidosis, and instead of giving hypertonic dextrose solution, you are giving the sodium bicarbonate, that also will completely deteriorate the condition. So entirely these 2 conditions are entirely different and we have to be clear cut in our diagnosis. That is the basic thing. For that, clinical examination plays an important role in diagnosing these 2 conditions. So as already telling, as a veterinarian, first rule out acidosis, ruminal acidosis, whether the animal is having acidosis or not. Then you can diagnose all other conditions very easily. As we already known, the major elements involved in the metabolic conditions are calcium, phosphorus, magnesium, potassium, glucose, vitamin B12, niacin, and cobalt. So we have already seen about the calcium and the phosphorus. Now we'll see about what is the role of glucose and this one magnesium. And in this session, the same thing as part 1. Here also, I'm not going into the theoretical aspect of all the metabolic activities or biochemical activities or pathogenesis like that. A nutshell pathogenesis and followed by clinical diagnosis, how to appreciate the clinical signs, how to approach the cases in the field. Because as a field veterinarian, we are going to attend the case in the field level without any gadgets or without any facilities. We are attending the case at the doorstep level of the farmers, and by appreciating the clinical sign and supporting up with the minimum gadgets, how to diagnose all these cases. So first we will see about the ketosis. Is one of the important condition in the ruminants, and many of the cases when the symptoms is obvious, we can able to diagnose it easily. Some cases like subclinical ketosis and all, many of time will be undiagnosed. It will go undiagnosed, or we cannot able to find out the reason, and it will naturally some cases will recover. Sometimes we may misdiagnose the case. So it depends upon the intensity. Not all the animals exhibit the same clinical signs in ketosis, like nervous form or wasting form, as we are studying in the academic part. Each and every case will vary in the clinical signs. As a comprehensively, you have to identify, you should know how to identify the comprehensive clinical signs of ketosis and how to identify. So the main part of the etiological thing in the ketosis is the negative energy balance. For example, when the animal is calving, after calving and before calving, this is a transition period. Before calving, the animal needs more energy for the development of the fetus. After calving, the animal needs more energy for the lactation. So according to the milk yield and lactation, we have to supplement the feeding management. Suppose 10 liters of milk yield is there, means according to the 10 liters, we have to give the feeding management so that the animal will get energy from the feed and it will be the balanced energy balance, so that all the metabolic process will be in the normal pathway. So when there is increase in the milk yield, when you are giving the reduced input, naturally there will be a negative energy balance, though the animal will be having, it will be drawing the energy from the other sources like fat will be mobilized and it will form the ketone bodies. So I'll explain you how it is forming. So failure of providing sufficient glucose during lactation, I mean, according to the feeding management, through the feed, propionic acid, three things are there: acetic acid, propionic acid, butyric acid. These are the volatile fatty acids produced in the rumen. And propionic acid is the precursor of glucose. So when there is a low energy diet and all giving during the peak milk yield, there will be naturally low production of propionic acid during this time. That will lead to negative energy balance. And in some cases, the high butyric acid content in the silage are more ketogenic. So that is also one of the reason. The main thing is the negative energy balance and the failure to provide a sufficient glucose during lactation and a high amount of butyric acid in the silage. And sometimes there may be stress during parturition or lactation and late lactation because of the dysfunction of adrenal. That is also a minimum etiological factor involved. And high protein diet also produces more butyric acid. And starvation due to any other conditions. It may be a foreign body syndrome, pericarditis, peritonitis, any other conditions, any other ailments. The animal is starving. Because of starving, the animal go for negative energy balance. And because of the hepatic insufficiency, that also leads to the accumulation of ketone body level in the body. So we classify according to the things, the primary ketosis and the secondary ketosis. Primary ketosis is a metabolic cause. It's purely a metabolic cause. As already told, the negative energy balance, and because of the metabolic cause, it's a primary ketosis. Secondary ketosis means is due to any other disease condition. I mean, suppose it may be some gastrointestinal dysfunction or peritonitis or pericarditis or any foreign body syndrome or any other condition, metritis, mastitis, all these conditions due to leading to starvation of the animal, that leads to secondary ketosis. So primary ketosis and secondary ketosis. Sometimes you will be treating a case of ketosis, diagnosing as a case of ketosis, but it won't respond. Again it will recur. So you have to see the underlying cause. Recurrent ketosis means you have to see the underlying cause of the secondary ketosis. What is the reason? Whether it is having metritis is there or not, mastitis is there or not, any other foreign body syndrome, that we have to rule out if it is a recurrent one. So in the wasting form, the nervous form, alimentary form, starvation ketosis, these are the various forms of ketosis, and this is mainly due to the negative energy balance, that you have to keep it in mind. All the main thing here is the negative energy balance and the improper ration of the feed and low feed supply during the lactation period. So here again the classification is there. Just for your understanding, I'm telling it will not be a confusing one. Type 1 ketosis, that is a spontaneous ketosis, it's a gluconeogenesis pathway stimuli. That is ordinary, we are seeing all the cases and all routine cases that we are seeing, the wasting form or nervous form or whatever the things. They comes under type 1 ketosis. Type 2 ketosis, you might have heard about this one, type 2 ketosis, that is due to fatty liver syndrome. Here, the gluconeogenic pathway is not stimulated. So whenever you are getting a case of ketosis and you are treating a ketosis case, 1 or 2 days you will be treating the ketosis with a hypertonic dextrosolution, D20 or D25 you will be giving. Again, there won't be any improvement in such a conditions. So you have to think about type 2 ketosis. Here, in type 1 ketosis and all, the glucose level will be low. There will be hypoglycemia. In type 2 ketosis, the glucose level will be high. Hyperglycemia will be there. That is mainly due to fatty liver syndrome. Once you identify these two things, you can manage the case very well and you can plan your treatment accordingly and you can successfully treat the case. And most of the time, type 2 ketosis, it won't respond to our routine treatment. So you can tell the prognosis accordingly. So type 3 ketosis is a cows which are fed with the high in maize, results in high butyrate production. So this is another one form. So in dry period, overfeeding also will be predisposing factor for the fatty liver. So that we'll discuss in the fatty liver session separately in the coming slides. So how the ketone body forms. As a veterinarian, we should know about the basic thing, how ketone body is formed. So in the last part 1, we have discussed about how calcium is mobilized and all. Once you keep it in mind, it will be easy for our clinical application. The same thing, ketone body, how it is formed. A low insulin glucagon ratio stimulates the lipolysis from the adipose tissue. Suppose a low insulin and glucagon ratio, naturally it will stimulate the lipolysis from the adipose tissue, and it will comes to the liver and the ketogenesis in the liver. So cows in the early lactation naturally have low insulin and glucagon ratios, and because of the low plasma glucose concentration, they are in the catabolic state. See here, the two major source of ketone bodies. There are two major source of the ketone body. One thing is the butyrate in the rumen. We all know in the rumen we are having volatile fatty acids, acetic acid, butyric acid, and propionic acid. So acetic acid is a precursor of milk fat. For milk fat synthesis, acetic acid is needed. Propionic acid, it is a precursor of glucose. So it is a gluconeogenesis. Butyrate, it gives energy. It should be in the that certain level, minimum level. So acetate, propionate, butyrate. These are three things in the volatile fatty acid that present in the rumen. And the butyric acid, butyrate, which is produced in the rumen, is absorbed as beta-hydroxybutyrate in the blood, and it is used as an energy purpose. Once it is exceeding the normal level, then it is a hazard. So the one of the source of ketone body is from butyrate in the rumen. So it is converted into beta-hydroxybutyrate in the rumen. The other source, the other main source is the mobilization of fat. For example, a cow which is yielding 10 liters or 20 liters of milk yield, a cow is there, cowed 2 months back, and the energy supplement, the feed supplement is not according to the milk yield or the lactation. So naturally, it is not getting the energy from the feed. So what will happen? That is a negative energy balance. So the cow will start getting the energy from the mobilization of fat. So what will happen? Mobilization of fat will occur. So from the adipose tissues, and it is coming to the liver as a free fatty acids in the liver. So it mobilizes fat and it is accumulated as a free fatty acids in the liver. In the liver, these free fatty acids is oxidized. You have to keep it in mind. It is oxidized to acetyl-CoA and NADH as an energy purpose. It's a common normal pathway. See, the free fatty acid is oxidized to acetyl-CoA and NADH. So for oxidation process, what is needed? It needs oxaloacetate. So it needs only in the presence of oxaloacetate, the acetyl-CoA, the free fatty acids are oxidized to acetyl-CoA and NADH. So for oxaloacetate production, we need propionic acid. So what is, so you can clearly identify when there is low feed supply, when you are giving low energy feed, there will be reduced production of propionic acid. Reduced production of propionic acid will lead to reduced availability of oxaloacetate. Reduced availability of oxaloacetate will not enable this oxidation process. Okay, this is the pathway. This is a normal pathway. So once it is oxidized, acetyl-CoA and NADH, it enters the TCA cycle in the presence of oxaloacetate. So oxaloacetate needs propionic acid. Okay. So in need of when there is low propionic acid level in the rumen because of low energy supplement or low feed intake, naturally it is metabolized. So these are, instead of oxidation, it is metabolized into acetoacetate and beta-hydroxybutyrate. These are all the ketone bodies, two ketone bodies, and that will lead to ketonemia and ketonuria. That will exhibit the signs of ketosis. This is the pathway. Once you understand this pathway, this is very easy to understand, and clinical applicability will be very easy. So the two sources, one thing from the rumen, another thing from the mobilization of the fat. Fat is mobilized to the liver, and in the liver it should be oxidized. It should be oxidized. It needs oxaloacetate. So oxaloacetate, there is a need of propionic acid. So if there is no propionic acid, low availability of oxaloacetate, it cannot oxidize. So naturally it will be metabolized to acetoacetate and beta-hydroxybutyrate. So these are the two major sources of ketone body. So the disease occurs immediately after postpartum. Most of the time, the ketosis occurs mostly around 1 or 2 months because of the peak lactation, during the peak lactation. But we cannot say exactly like up to 60 days, up to 30 days, up to 40, not like that. It can occur at any time according to the availability of the feed for the animal. So early lactation period are more prone for ketosis, even mid lactation also. And according to the availability of the feed intake and the production level, it varies. and is also less common. And occasionally in pregnant animals also we can able to see the ketosis, but mostly in the lactation period. And in the wasting form, suppose you are examining the animal, all the vitals are normal. There is no temperature, the heart rate is normal, pulse rate is normal, respiration rate, everything normal, but the animal is inappetence. Some animals, they will take roughages alone, or they won't take concentrate. There will be a slight reduction in milk yield or reduction in the milk yield. Some animals will be standing woody appearance. They will stand, I guess, stand still like woody appearance. Some animals will have gait abnormality. When you go and touch the animal will suddenly it will fall down. When you go and touch the animal for any clinical examination or to give any injection, suddenly it will fall down. Or when you make the animal walk, it won't walk. It's a reluctant to walk. I will show the video. Gait abnormality may be there. Staggering gait, sometimes mild staggering gait may be there. In some cases, vision impairment will be there. All signs, everything will be normal, but the animal cannot able to see. Vision impairment will be there. And the reduction in the milk yield will be there. It varies. No, all the clinical signs won't be exhibited in a single case. Okay. Each and every case, you have to comprehensively, collectively evaluate the cases, clinical signs. So it may not occur in all the cases. You selectively, you go for a searching of this type of clinical signs during the early lactation period, and it is a form of wasting form. And in the nervous form, it has convulsions. The animal will be having convulsions. Some animals will be having self-biting. It will bite the inanimate objects. It will bite the, sometimes it will bite the trees or inanimate objects or wherever it is standing, or the trees, or champing of the jaws will be there. Some animals will be having circling. Apparent blindness will be there. Animal will be having aimless walking, wandering. Some animals are reluctant to move, as we discussed earlier. So depending upon the individual intensity of the availability of the ketone body in the blood level, this nervous form will exhibit. Some animals may falling down. Some animals will have, when you touch the animal, it will fall down, circling, chewing movement with the salivation, head pushing, vigorous licking of the skin. All these things will be there. This type of conditions, you will be getting confusion whether it is suffering from ketosis or hypomagnesemia. So in assessing in the condition without any laboratory aid, we are attending a case in the field condition, means sometimes we may be getting confusion with the hypomagnesemia and this ketosis. I'll tell you. In hypomagnesemia, there will be having tonic-clonic convulsions will be there. So here you can see animal. So the animal calved 3 months 3 months back, reduction in milk yield, and is not taking feed. Thus we make the walk the animal, and see the animal is having vision impairment. It cannot able to see. All other activities are normal, only the gait abnormality is there. So when you make the animal to walk through a place something like this, and it cannot able to jump over the gutter, just it will fall down. That indicates vision impairment is there. So just by treating, just you can go for the treatment with the hypertonic dextrose solution, the condition will improve immediately. So this is another one. This animal, the owner is pulling the animal. It's a reluctant to walk. So normal animal, when they will be pulling, it will walk freely. Some animal, when you are putting the animal in the travis, it is reluctant to walk. That is an entirely different one. See, this animal is reluctant to walk. This is also a type of ketosis case. So this is after the treatment. After treating with the hypertonic dextrose solution, the animal is walking freely. It is waving the tail and moving the nodding the head and all ears and walking freely. So that indicates the animal becomes normal. So by seeing the gait also, we can able to identify the condition of the ketosis. As I told, in wasting form, the animal will be having inappetence to complete anorexia, milk yield will be reduced, and the animal will be woody appearance. The dung will be normal in consistency. Suppose the dung is a semi-solid or watery in nature, you think about acidosis. So you palpate the rumen for presence of any fluid splashing sound. And if it is having fluid splashing sound with the diarrhea, you think about acidosis. Here the dung, everything will be normal. Okay. And regarding the clinical pathology, you can able to see the low blood glucose level and the presence of ketone bodies in the urine and the milk. So we are not having the facilities. Suppose you are in any academic institution, immediately or nearby laboratories available, you can collect the blood sample, serum sample, and you can evaluate the blood glucose level, and you can collect the urine, and you can go for the presence of ketone body, evaluation of the presence of ketone body in the milk or urine. But in the field practice, how to identify, we are having small gadgets that also you can implement. So the typical thing is a hypoglycemia, hyperketonemia, and ketonuria is the classical one. So diagnosis mainly by clinical signs, by appreciating the clinical signs, as we told, either it may be a wasting form or a nervous form. And Rothras test is commonly used in the field conditions, and the presence of beta-hydroxybutyrate strip test and the response to the treatment. Most of the time in the field conditions, either it may be a clinical or subclinical ketosis, we come to a conclusion or the diagnosis by response to the treatment. So you may be treated with hypertonic dextrose solution. So after treating with, the animal will respond to the treatment. So you will diagnose as a ketosis. So in the field test, Rothras test, you may be having Rothras powder. I think everyone might have been used the Rothras powder. You take a test tube and put the Rothras powder and 5 ml of urine and mix it, and immediately you can get the discoloration of a pink color will be noticed, and that indicates the presence of ketone bodies. Sometimes we may be getting negative. Sometimes we may be getting negative result in the Rothras test. And why? Because this Rothras test is effective or sensitive only for acetoacetic acid, so not for beta-hydroxybutyrate, and very little action reaction for acetone. So acetoacetic acid only, the presence of acetoacetic acid only will reveal in the Rothras test. That's why when you are getting negative result in this Rothras test, but the animal will be showing clinical signs of ketosis. So that is the reason because of this one. So for that, what we have to do, we are having separate strips for identifying beta-hydroxybutyrate. It is available in the market. So this Rothras test is specific for acetoacetic acid only. And you can use this type of urinalysis strip, which is commonly available in the field everywhere. We are using for human and also in the canine practice, everyone is commonly using this. This type of strips also you can use for identifying the ketone body. Number one. So number one, we have seen about Rothras test. Number two, this type of urinalysis strip, and this type of ketosticks reagent strips are available online. So you can very well get these strips in the online. That also you can use it for identifying the presence of ketone body in the urine. It's a very simple. Just collect the urine and dip it, and within a fraction of a second you can identify it. And this type of strips are also available. Beta-hydroxybutyrate strips are also available. It's available here everywhere. And these type of strips are very highly effective in identifying the beta-hydroxybutyrate in the urine. It's very effective. You can use in the milk also. It's a milk ketone test. And this type of glucometer is available. So you might have seen in all the homes or everywhere it is commonly used. Whenever there is a diabetic patient in home, they will be having this type of glucometer in the home for day-to-day screening of their blood glucose level. The same thing you can use it for grossly identifying the level of the glucose of the animal. So the reagent strips are, the glucose strips are available. So you can get it from every medical shops. It's cost around 1,000 rupees to 1,500 rupees, and you can very well commonly use in the field practice. So for example, you just connect the strip and put a drop of blood, just prick the ear, tip of the ear or ear vein, and just get a drop of blood. Immediately it will show the glucose level. See, the normal glucose level in the ruminants is around 45 or 50 to 65. That is the normal glucose level. So here it is showing 20 milligram. So it is very low hypoglycemia. So it's very less. So you can if you are using this, if you are having a doubt in identifying the clinical sign, you are getting confusion whether it is a ketosis or not, by seeing the glucose level, you can come to a conclusion. You can narrow down the diagnosis. It will be helpful for you to whether you can use the hypertonic dextrose solution in this condition or not. So very well, we can decide your treatment. For example, you will be treating on with a dextrose solution for more than 1 or 2 days, but you won't be getting the result. But you can see that after seeing this type of glucose evaluation on the spot, you can decide your treatment, whether this animal needs glucose or not, dextrose therapy or not. Suppose a case, I'm seeing the glucose level is showing 112 or 100. Can I give the hypertonic dextrose solution? No, I won't give. So already it is having hyperglycemia. So I will decide the treatment accordingly. I have to go for other clinical examination. What is the problem apart from the ketosis? So it will be more helpful for planning the treatment. And this glucometer, this is the beta-hydroxybutyrate The same thing, strip is available. This is also available in the market. So just put the insert the strip and put a drop of blood, and immediately it will give the result of presence of the level of beta hydroxybutyrate in the blood. Now it's showing 42.6. More than 16 is a positive one. So less than 16 is a negative. More than 16 is a positive one. And immediately you can very well decide the treatment. And for the follow-up also, you can treat it and decide it accordingly. These are all the small gadgets. We can have a investment, some investment for our clinical practice, and we can keep it in our practice kit, and use it whenever it is needed. For example, suppose you are diagnosing a case very successfully by clinical science alone, and you are treating it with the hypertonic dextrose solution, it is recovering, which is well and good. In some cases, you will be getting confused whether it is a ketosis or not, why it is not responding to the treatment. In such a cases, you can use all these gadgets, and you can come to a conclusion. The blood glucose level in this case is this much, the ketone body level is this much, so you can plan it accordingly and treat it very easily. So when during our clinical practice, if you are investing a small gadgets for getting a stomach tube or a thermometer, a stethoscope, and this type of this ketometer, glucometer, once in 2 months you get a small gadgets that will be helpful for our clinical practice. That will show the improvement in the field practice. So in this case, it's showing high. So when there is abnormal elevation of beta hydroxybutyrate beyond the level, it will show like this. It is showing high level. It's a ketometer. So the normal blood glucose level is 50 to 65 milligram per deciliter. And in primary ketosis, mostly around the glucose level will be around 20 to 30 like that. In the secondary ketosis, you have to think about when there is increase in the glucose level more than 50, but animal is not responding to a treatment, you have to see the underlying cause. Always you have to rule out the underlying cause. So these are the level of the beta hydroxybutyrate in the blood. It should be less. If it is greater than 2.5 millimole per liter, it is a clinical ketosis, and 1 millimole per liter is a subclinical form. So most of the time you will be missing the subclinical form. The subclinical ketosis always it will be having reduction in milk yield, inappetence. That's all. So just by seeing these things, recently cowed animal, or 1 or 2 months recently cowed animal exhibiting reduction in milk yield and inappetence to anorexia. So think about no fluid splashing sound in the rumen and no diarrhea. The dung is normal consistency. All these things suggestive of treatment for ketosis. So you treat it for ketosis and see the response to the treatment for ketosis. And regarding the treatment, so many veterinarians will have 20% dextrose, 25% dextrose, 50% dextrose. Will be asking out which we have to use. Any hypertonic dextrose solutions you can use, no issues. Either you can use 20 dextrose can be used, or 50% dextrose can be used, 25% dextrose can be used. A dextrose with the electrolyte combination like interlite, that also can be used. It depends upon the availability of the hypertonic dextrose solutions. So there is no particular about 20, 25, 50 and all. If the 50 is available, it is well and good. Otherwise, you can use the other availability of these hypertonic dextrose solutions. And also you give the dose is around the quantity you have to give are 500 ml to 1.5 liters. That means 1 to 2 sachets or 3 sachets is more than sufficient for the animal, and give it IV. And regarding the speed, there is no slow speed and all. Since it is a fluid, you can give it as a fast, no problem. And like calcium or magnesium, there is no need of giving drop by drop like that. So you can give it as it is. But only the thing, when you are giving more amount of hypertonic dextrose solutions, 1 or 2 times, 1 or 2 days continuously, there will be a transit reduction in the phosphorus level in the body. That is a common one. So in such a cases, when you are going for 1 or 2 days of treatment for the hypertonic dextrose solution, you can supplement oral phosphorus preparations so that it will be corrected. And you can go for dexamethasone 40 milligram. You can give IM. Okay, it will enhance the gluconeogenesis. So steroids like dexamethasone can be given 40 milligram intramuscular. So hypertonic dextrose solution followed by dexamethasone. Some veterinarians they will be using isoflurane. That also you can use. So you need not combine both dexamethasone and isoflurane. You either use any one steroids, either isoflurane or dexamethasone or prednisolone also you can use. According to our availability, you can use any one among these three things, any one you can use. And regarding the isoflurane, as already we have discussed in the part 1, you should not use it as a indiscriminately for 2 to 3 days like that continuously. So without any indication. For example, you are using for a ketosis treatment, no problem. You can use it. Today you are using with the hypertonic dextrose with the isoflurane injection. It's okay. But you are suspecting for recurrent ketosis, again you are treating second day D20 or 25 with the isoflurane, and again you are giving isoflurane. So indiscriminate use of isoflurane will lead to hypokalemia. That you have to keep it in mind. In some cases, so normally most of the cases in the clinical practice that will respond very well to the hypertonic dextrose D20 or 25 with the dexamethasone or D20 with isoflurane, it will respond very well. It's okay. The next day or within 1 or 2 days, I will become normal. The milk will become normal. Feed intake, everything will be normal. In some cases, recurrent ketosis will be there. Second day also it will be there. In such a conditions, when needed, you can use insulin also. Insulin can also be given. So it can be given at the dose rate of 200 to 300 international unit subcutaneously at 24 hours interval. So this is the insulin preparation that you can use. So it's available as an insulin lenti injection as a 500 units vial is available, and each ml contains 40 units. Each ml contains 40 units. See here, this is the insulin syringe. This is commonly used for small administration, the insulin, and this is commonly used for small animal practice, dog also. Just I'll tell you how to calculate the units. But here for large animal, no problem. For easy to calculate the 300 units. So from 500 units, you can take, for example, 10 ml is there. Each ml contains 40 units. We need 400 units means the 10 ml. 300 unit means accordingly you can collect in the syringe and give subcutaneous. That is very easy to calculate. But you are using a dog, it means the calculation is important. 40 units is equal to 1 ml. See, 40 unit is equal to 1 ml. Suppose in dogs and all we used to calculate 0.5 units per kg body weight means a 10 kg body weight in 10 into 5, 5. So up to 5 they will take and give subcutaneous in dog. So for that only the insulin syringe is needed. For here our large animal practice, you can take it directly from our routine syringe, like 5 ml syringe and all, and you can give 200 to 300 units. You can load and give subcutaneous. The only thing you have to keep it in mind, the insulin should be given only after administration of dextrose solutions. Without administration of the dextrose, you should not give insulin. Why? If you are not giving dextrose solution and if you are giving only insulin alone, what is the role of insulin? It will mobilize it will enhance the entry of the glucose into the cells. So already the animal is hypoglycemic. You are giving only insulin means the animal again it will go for hypoglycemia and coma, the animal will collapse. So you have to take care. Why I am telling in the commonly in the field practice, we will be prescribing D20 and insulin to the farmer, and he will be going and getting these medicines from the medical shop, and insulin may not be available at that time. Only he will be bringing D20. So he will be giving D20 in the morning. So they will be telling insulin will be available only in the evening. So I will come and put the injection in the evening. So in the evening, you should not give the insulin alone. So what will happen? It will go for hypoglycemia. So you have to give concurrently with the treatment. Otherwise, you should not give. So you are giving the treatment of D20 or D25. After that, you are administering you are giving insulin. That is the protocol. Otherwise, don't give insulin alone. It should not be. Okay. So you are not using insulin in all the cases. Whenever it is needed, then you can use it in the recurrent cases after evaluation. So when you have to give insulin treatment, only after evaluation of the blood glucose level, you have to go for insulin. Without evaluation of blood glucose level, you should not go for the insulin treatment. You can easily evaluate the glucose level by using the glucometer. The other line of treatment, as already we have seen, the treatment regime, D20 or D25 hypertonic dextrose solution along with the steroids, either it's a dexamethasone or prednisolone or isoflurane. Okay, when it is needed, you can add insulin also. This is all the line of treatment. The other line of treatment for follow-up is propylene glycol or glycerin. You can give orally 220 gram, 200 gram or 220 gram orally daily for few days. The only thing you should not get aspirated. It should not get aspirated. When you are drenching the glycerin, in villages and all, they used to give jaggery and all. So they used to give glycerin. So when you are drenching the glycerin, you should not get aspirated. So you can mix it in the feed and you can give it orally as a bolus or electrolyte you can give instead of drenching. Any preparations, whenever you are drenching, you have to take care it should not get aspirated. Otherwise, it will lead to aspiration pneumonia. The other things we can use a sodium lactate and ammonium lactate if it is available. That also can be used. It is available from the chemical shops, and that also can be used orally. And cobalt and vitamin B12 supplement is very, very needed in the treatment of ketosis, because cobalt and vitamin B12 are the essential component for the production of propionic acid. So whenever you are treating a case of ketosis, you supplement with vitamin B12 and orally cobalt. Any bolus form or any bolus preparations available, you can give it. So that will enhance the production of propionic acid, and we are having a very good follow-up. And as a commercial available, many things are available in the market. You can use these things of gluconeogenic oral supplements like e-booster, and many names are available that you can use it for the follow-up use. So first line of treatment is hypertonic dextrose solution with the dexamethasone or any steroids. You should not combine all the steroids together. Any one you have to use, followed by gluconeogenic preparations morning and evening, so that it will enhance the energy level. So as already discussed, the IV injection of 50% solution of glucose will result in transit hyperglycemia, and that will be increased in the insulin and decrease glucagon secretion and reduce the plasma concentration of NEFA. So as already told, hypertonic dextrose solution, rapid infusion or more amount when you are giving, that also leads to transit reduction in the phosphorus level also. That you can supplement or correct it with oral supplementation of phosphorus or any injectable inorganic phosphorus. Injectable phosphorus are available, oral phosphorus is also available that you can use. So the main line of treatment is hypertonic dextrose solution with dexamethasone or isofloperidone. So how to differentiate the secondary ketosis due to the other conditions? Suppose we are treating a case of ketosis, but it is not responding. One day it is responding, again it is recurring. So second day it's not taking feed and all. Then you have to think about the secondary ketosis due to traumatic reticuloperitonitis, abomasal displacement, metritis, mastitis, all these things you have to keep it in mind, and you have to go for the clinical examination. Metritis you can see very easily. During the vaginal examination, you can able to see the obvious mucopurulent discharge, and mastitis is obvious. And abomasal displacement, some clinical examinations are there. You can appreciate the ping sounds. Either it's a left side or right side that you can diagnose. And peritonitis and pericarditis and all that you have to differentiate clinically. So peritonitis, as already we will be discussing, you have to put the abdominocentesis. You have to put the 16 gauge or 18 gauge needle from the xiphoid 10 centimeters caudal, 5 centimeters left or right side lateral, and put the needle and rule out any free flow of peritoneal fluid is coming or not. So all these things you have to differentiate when there is no response for the treatment of the ketosis. The nervous form of the ketosis, you have to think about the rabies, hypomagnesemia, and listeriosis. So always you will be getting confusion when you are attending a case. So whenever you are attending a case of a suspected nervous form of a ketosis and it is not responding, you think about all these things in mind and clinically evaluate and treat it accordingly. See, here you are seeing a case. So the animal is having a slightly excited and having frothy salivation. So frothy salivation and a shivering is there. So in ketosis, there won't be any frothy salivation like this. So see the eyes and all, it is having anxious expression like wild expression is there. And it is a case of rabies. It was previously suspected they are treating for a ketosis, but it is a case of rabies. After some time, it will have a bellowing, typical abdominal bellowing will be there that you can appreciate. Once you appreciate that abdominal bellowing, you can confirm it is a case of rabies and put it under isolation. So see the frothy salivation and the elevation of the tail and pumping of the anus will be there. So in rabies, frequent pumping of the anus will be there. When the animal, you make the animal walk, the hind quarter will be, incoordination of the hind quarters will be there. So this type of abdominal bellowing will be there. See, So this type of abdominal bellowing there will be in case of rabies, not in ketosis. So when you are going for treatment and all, when animal is showing this type of clinical signs, you have to rule out rabies. So the animal is having frothy salivation with abdominal bellowing. So this is a clear case of rabies. And you need not confuse whether it is a nervous form of ketosis or not. And see another one nervous form. See here the animal is having involuntary twitching of the muscles, ears, eyelids, and all. And it will mimic. You will be suspecting whether it is a ketosis or hypermagnesic tetany. So when a glucometer and other gadgets are available, immediately you can see the glucose level. Then you can go for the treatment and all. Otherwise, in the field practice, what we used to do, you can combine the Myfex solution and T20 so that the response to the treatment will evaluate the cases. So it's a case of hypermagnesic tetany. So twitching of the eyelids and the frequent tonic-clonic convulsions is there. So in field conditions, we are getting confusion. We will be treating with both the conditions. Response to the treatment will evaluate the condition. We will be using both the D20 and magnesium solutions. So this is another form of ketosis. So the animal is licking the inanimate objects and biting or chewing the inanimate objects. And the animal is standing, is lying on the travis. So that is called lean on the stanchion. So it's having a shivering and it is getting the support of the travis. So in home, when you are going and attending the case in the home also, the animal will be going and getting the support of the wall and having some nervous signs. That is also typical of ketosis. At times they are having elevation of the head and all, and frequently shaking the head and all. That also showing in nervous form of ketosis. Like this, frequently champing of the jaws will be there. Frequent champing of the jaws. So when the champing out, that is called smacking of the lips or the champing of the jaws is there, you have to think about oral cavity examination. So first you have to evaluate the oral cavity and see any lesions is there or not. In FMD also, the animal will be having frequent champing of the lips, like smacking of the lips will be there, and drooling salivation will be there. If there is any foreign body in the oral cavity, that also that time salivation will be there. So you have to examine, pull the tongue and examine the oral cavity for any lesions or any other foreign body. If no foreign body, nothing is available, it's having frequent smacking, you have to think about ketosis. And this is another case. So the animal is not able to get up. See, the animals are having frothy salivation, and see the eyes, it's having anxious expression, and the animal cannot able to get up. And this is a case of rabies. So it's a case of rabies. See this case, the same case. So if you wait for a few seconds, it can exhibit the clinical signs. See, the animal cannot able to stand because of the hindquarter incoordination. And the eyes, see the eyes, you can able to appreciate the anxious expression. Salivation is there. And frequently bellowing, abdominal bellowing. That is a classical sign of rabies. So frothy salivation, anxious expression, abdominal bellowing, to differentiate rabies. So you need not to get confused. So without your knowledge or unknowingly, you have been treating for ketosis and not responding when it is showing signs of this type of signs, you have to be careful and put the animal under isolation. And this is another case. See, it's frequently licking the soil, and the animal is alert and frequently licking the soil. 2 or 3 things you have to keep it in mind. See the mucous membrane, whether it is anemic or not. And in the blood protozoan disease, because of anemia, also the animal will be having the licking behavior and it will be eating the sand. That also you have to keep it in mind. Mucous membrane is normal, everything is normal, but the animal is having chewing behavior and licking the soil and all. You have to think about nervous form of ketosis. And in phosphorus deficiency also it will be like that. But in that, there won't be any nervous signs. Only it will have eating the inanimate objects and all, it will be there. So in this video, you can able to see this animal is cowed 2 months back. It's not taking feed, and sudden reduction in the milk yield. All parameters were normal. See, the animal, when the owner is pulling, it is reluctant to walk. It's not walking freely. He is pulling the animal. This is also one of the classical type of it's a case of ketosis. So when you are pulling or pushing the animal, it's a reluctant to walk. All other things, animal is everything normal. So in such a conditions, you have to differentiate from tetanus. You have to differentiate from tetanus. See whether the erected ears are there, any bloat is there, and you can bend, just bend the neck. Whether the neck is bending freely or it is very stiffness. If it is very stiff, not able to bend the neck, erected ears are there, then you think about tetanus. Otherwise, it's a case of ketosis. So after treating the case, it will walk very freely and normally. So you can collect the urine and check it for ketone bodies, and you can see the blood glucose level, and you can treat it accordingly. So case of reluctant to walk. And sometimes the animal may be having vision impairment. So it's called obstacle test. So in such a conditions, you can go for the vision impairment test is called obstacle test. Video is not playing. So just when you put a pole in front of the animal will, while walking, it will hit the pole and it will be there because of vision impairment. And other animals, they will avoid the pole. The video is not playing. So see here, the other things you have to differentiate from listeriosis. Here, both eyes, the menas reflex is absent. That indicates the vision impairment. The palpebral reflex is also absent. And see the ears, drooping of the ears is there. So these are all indicative of facial paralysis due to listeriosis. So that also you have to rule out by clinical examination. See, the left ear is droop. The left ear is droop, and the salivation is there, and the animal is not able to see the vision impairment is there. By this clinical examination, you can differentiate. This is a case of listeriosis, facial paralysis due to listeriosis. So the differential diagnosis, you can make it according to the clinical examination, and you can very well classify what is the condition and then treat it accordingly. Suppose you are treating a case of ketosis and that is not getting response, and you are getting recurrent ketosis. Many of the veterinarians, they used to ask doubt, sir, I have treated a case of ketosis, but recurring. It is again and again recurring means you have to see the blood glucose level. It is a mandatory. You have to see the blood glucose level and rule out the underlying cause. And if it is a type 2 ketosis, mostly the prognosis is poor. As I already told, if the blood glucose level is high, I mean more than 80, it is like 100, 120 and all. Daily it is like that means you have to think about any sepsis, septicemia, any inflammatory conditions, or fatty cow, fatty liver syndrome. These three things you have to keep it in mind. So hyperglycemia is a prognostic indicator of a poor prognosis. It won't respond to our treatment. Sometimes the animal may be having nervous signs and all, and ketone body presence will be there in the urine, but the blood glucose level will be elevated. So that cases and all, it won't respond to our treatment. In such a cases, when the animal is having hyperglycemia, don't go for hypertonic dextrose solutions. Instead of that, you treat it for fatty liver syndrome. Mostly the response for the fatty liver syndrome will be poor prognosis. And you have to differentiate from fatty cow and abomasal displacement when there is any persistent ketonuria. So here the negative energy balance is the main thing, plays a role for the metabolic condition of ketosis. As I already told, in pregnancy, when the animal is in the negative energy balance, so it will affect the development of the fetus, one thing. Why in pregnancy it occurs? Because of in the pregnancy, the animal, the uterus will descend down and it will press the rumen, and the rumen size will be reduced. So that the reduced size of the rumen, then naturally the dry matter intake will be reduced, so that the animal will be having negative energy balance. That is in pregnancy. In lactation, during the lactation, during the milk yield, peak yield, the input will be very less. The feeding pattern, the input is very less, so that the animal will be in the negative energy balance. These two things we have to keep it in mind. That will exhibit the signs of ketosis, either it may be a form of clinical or subclinical form. So negative energy balance will lead to infertility and reduced milk yield also. Displacement of abomasum, all these things are consequence of the negative energy balance. So one important, just for awareness, I'm telling, the increased level of NEFA, non-esterified fatty acids in the blood is a clear indication that the animal is having negative energy balance. It's a classical thing. So we are seeing the blood glucose and we are seeing the ketone body level, and you can see the NEFA if any laboratory facilities are available. Suppose why I'm telling this, some are having a farm consultancy, very big farm. So we are having sophisticated laboratory facilities to see the serum samples. Means you can collect the blood sample and you can see the NEFA, non-esterified fatty acids. So increased level of NEFA indicates negative energy balance. So it's a very big entity. I'm not going in detail about the negative energy balance in detail, how the pathogenesis and all. So just as a field practice, you think about negative energy balance means there will be increased level of non-esterified fatty acids in the blood that will lead to metabolic conditions. So when non-esterified fatty acids exceeds the level, and it will be impairing the hepatic dysfunction. So it will impair the hepatic function. So there will be naturally hepatic insufficiency or hepatic dysfunction will be there. So always supplement liver tonics. Liver tonics you can supplement. And in case of negative energy balance, whenever you are correcting the negative energy balance, you supplement liver tonics for better efficacy, so that the increased level of NEFA can be reduced by improving the hepatic function.